EUS-guided fiducial placement for the treatment of pancreatic cancer with CyberKnife stereotactic radiosurgery. CyberKnife is one of the most commonly used stereotactic radiosurgery platforms that uses 3D target localization to precisely treat tumors with high-dose radiation with minimal surrounding tissue damage. It uses a moving robotic arm which quickly delivers multiple radiation beams. CyberKnife requires fixed radiographic reference points to target these radiation beams. Extracranial lesions are more difficult because there are no fixed reference points and because of respiratory movements. To overcome these difficulties, small metal objects called fiducials can be placed to assist targeting. A 3mm gold fiducial is shown here. These are designed to pass through a standard 19-gauge FNA needle. Requirements for CyberKnife fiducials include a minimum of 3 fiducials with an angle of at least 15 degrees and a distance of 2 centimeters between any 2 fiducials. In 2006, U.S.-guided placement of fiducials for the treatment of extracranial malignancies was first reported in gastrointestinal endoscopy. In this case series, the authors demonstrated successful placement of fiducials in 11 of 13 patients without any reported procedure-related complications. An ex vivo demonstration of our new technique of backloading the fiducial to facilitate easy tissue delivery is shown here. The standard 3mm fiducial, forceps, bone wax, and Wilson Cook 19-gauge FNA needle are displayed here. First, the 19-gauge needle is grasped in one hand while the other hand makes use of forceps to control and guide the fiducial. The fiducial is then backloaded into the 19-gauge needle with the stylet retracted slightly to accommodate the fiducial. The fiducial is secured in place with sterile bone wax. Note that this technique differs from previous studies where the fiducial is front-loaded into the needle lumen and pushed with a stylet through the entire length of the needle prior to delivery. Firing of the fiducial is demonstrated here. Now we will turn to our case presentation demonstrating the technique just shown. This is a case of a 92-year-old gentleman who initially presented with new onset abdominal pain. He has a past medical history significant for coronary artery disease and atrial fibrillation. CT scan for abdominal pain showed acute inflammation, calcifications, and possible mass in the body of the pancreas. The patient was then sent for EUS FNA. EUS revealed a 36 by 29 millimeter pancreatic body mass. EUS fine needle aspiration diagnosed adenocarcinoma. The patient was not felt to be a surgical candidate and therefore opted for CyberKnife treatment. For fiducial placement, a therapeutic Olympus linear array echo endoscope was used. This scope has a large 3.7 millimeter working channel which allows passage of the 19-gauge needle. First, the mass is identified, then Doppler is overlaid on the EUS image to confirm absence of vascular structure within the potential needle path. Once the tumor was felt amenable to fiducial insertion, IV ciprofloxacin was given. The 19-gauge FNA needle, previously backloaded with the fiducial, is then passed through the instrument channel and advanced into the periphery of the mass. The stylet is then advanced to deploy the fiducial into the mass. The fiducial is indicated here by a red arrow. The EUS FNA needle is then withdrawn and prepared for placement of the next fiducial. Placement of the fiducial is also seen clearly under fluoroscopy. Fluoroscopic imaging confirms the successful placement of 3 fiducials as required for CyberKnife treatment. Following fiducial placement, our patient was seen again by radiation oncology for CyberKnife treatment planning. This 3-dimensional skeletal rendering clearly displays the 3 fiducials, which are highlighted by red arrows. A CT scan demonstrates the appropriate location within the pancreatic tumor. The fiducials are highlighted here by purple circles. Here we see 4 CT reconstructions of the proposed treatment plan. The image in the upper left-hand corner shows the 145 cross-fired beams of high-energy radiation used for this patient. The 3 remaining images highlight the pancreatic mass, which is outlined in red. The lines surrounding the target are isodose lines in percentage of radiation delivered. The radiation is prescribed to a certain isodose line. Notice how the isodose lines tightly conform to the target and quickly drop off in order to spare the surrounding tissue. Our patient received a total of 3,000 centigrade in 3 fractions, which he tolerated well. His abdominal pain resolved following treatment. A CT scan at 1 month post-radiation showed stable tumor size without evidence of metastases. At 3-month follow-up, the patient continues to do well. In summary, this video shows the technique for EUS-guided fiducial placement for stereotactic radiosurgery treatment of pancreatic adenocarcinoma. We demonstrate a new technique of backloading fiducials with the use of bone wax for easier deployment than the forward-loading technique that is often complicated by difficulty advancing stylet and deploying the fiducial. Additionally, this technique does not introduce air at the time of fiducial deployment, unlike the front-loading technique. In conclusion, this video illustrates another avenue for interventional endoscopic ultrasound. EUS-guided fiducial placement can be considered to help target lesions for stereotactic radiosurgery. Finally, the backloading technique demonstrated here might be useful for implanting other materials to assist in cancer, marking, or treatment.